Once you log into Fisdap, go to the Reports tab and then click on Reports. Now, my view might look just a little bit different than the standard student view. Just as director, I should have a couple little options that the student doesn't. So to go over the reports, what I like to do is keep both tabs open and run all the reports at the same time. So we'll go to the Appendix G individual report, right click on it, open a new tab, and while that's running in the background on that tab, we'll go to the graduation requirements report here. So we'll select the Pierpont Paramedic tab. That is the goal set we want to go by. And then we're going to pick a student here. So let's just pick this Tacey fellow and hit go. Then in this report, you're going to do the same thing. Just select student, hit go. So these are going to be running, and it takes just about a minute for both the reports to run. Okay, I paused the video while the reports ran in the background, but you can see here the produced Appendix G report. So you're looking on all these categories here. You want to make sure that all these boxes are green. So from Table 1, this is all reports and patients done from field and clinical settings. Tables 2 and beyond is all information that was entered into Fisdap during labs. So for graduation, what we ideally want to do for the student's responsibility is to be making sure all these boxes here are green. Now you can see that there is some information missing here. Well, this has just been set up as a dummy account, not necessarily that the student in question is a dummy, but it's just an account used for testing purposes. So you can see here some things missing in Appendix G, missing a sepsis patient, a shock patient, 2 acute coronary syndrome patients, total IV medication administration was only 40. And then plenty of IM injections, plenty of inhaled meds. And then we'll go over here to the other tab for graduation requirement report. You can see here too, also missing 2 newborns in this category for this report. But in graduation requirements report, the big thing you're going to use that for is down here for skills and team lead. So we're looking here for total medications given, program requirement 50, that 104, has met the IV requirements, the intubation requirements, ventilation requirements, and ALS calls. Still a little short here, 35 ALS calls so far. Team lead total, that's the total amount of calls on ambulance, was 51. Okay, so what we're looking for here is these total calls. Whereas in the Appendix G, looking for team leads and capstone. That number gets generated there if in the student's account, when their capstone begins and when those calls are actually classified as team leads, that student's account will have a capstone begin date. So if that student count doesn't get updated as the actual specific date that their team leads began, it's going to put all the calls into this category. So basically those could be audited, just knowing that they have to have met the minimums before they can even get to their capstone. So this audit happens before the capstone and then after, so it's easy to compare those numbers. So even again, if you needed to do another report, go to reports, right click on it in a new tab, and say if you needed the hours report. You want to see where the student has spent all of their time, making sure they've went there. So one of these ones is due by standard departments. Select the student again and hit go. Then that report will run as well. Okay, so again, that report ran in the background. I'll pause the video for that, but you can see the breakdown of all the departments and hours that the student went to. If there's a question in these reports about observed things, generally that's just the student didn't mark the correct box. You can see here like 5 observed medications. So in the reports tab, you can go down to observed team lead report. So same thing, select the student, hit go, and let that report run. Okay, so the report's done. Now you can see all those things that were categorized as observed. Then you could go in and request to have these shifts changed, or a instructor can go in and help the student just change them without unlocking the shift. The instructors have the ability to check the right box so they can work with the student, make sure everything was put in it correctly, and then fix those and then regenerate those reports. Hopefully that clears up some of the things on how to process reports and to be tracking and understanding where you're at in the clinical and practicum phase.